NEA, Better Health Product Training Presentation for Licensed Health Agents and Brokers. Hello, and welcome to Better Health Training, presented by National Employers Association, A+ rated with the Better Business Bureau. We are proud to be celebrating our 64th year. Medical debt is crushing Americans. As of June 2023, around 15 million Americans had medical debt listed on their credit reports, totaling over $49 billion in collections. The average cost of a hospital stay per day is approximately $3,030 per inpatient day in U.S. hospitals, according to Becker's Hospital Review and Consumer Shield. A 3-day stay typically costs around $30,000 depending on the services provided. Starting in January 2026, ACA out-of-pocket maximums are $10,600 for individuals and $21,200 for families. These amounts represent the maximum out-of-pocket costs for covered services in a given plan year. Once these thresholds are met, the plan covers 100% of eligible in-network expenses for the remainder of the year. The Association Benefit Summary for Sickness and Accident pays a hospital admission benefit once per year that pays in addition to other coverage at a $5,000 benefit for Premier and Elite, or a $10,000 benefit for Premier Plus and Elite Plus levels. It also comes with a daily hospital benefit of $250 a day for all option levels, not including the Classic. The Elite and Elite Plus options also include accident-only limited benefit coverages that help pay accident medical expenses for hospital emergency room confinement, doctors, surgeons, labs, X-rays, and ambulance for covered accidents. The AD&D benefit is $5,000. The accident medical expense maximum benefit amount for our Elite level members is $5,000 and $10,000 for our Elite Plus level members. Either option has a $100 deductible associated with it, and it pays on an excess basis for this particular benefit. Accident emergency initial treatment for a physician visit pays in addition to other coverage. One visit per covered person per accident at $100 per visit. Follow-up physician visits pay in addition to other coverage at a maximum 4 visits per covered person per accident at $100 per visit. Accident emergency room pays in addition to other coverage at a maximum 2 visits per year per covered person per accident with a $100 benefit. Our monthly pricing for the individual or family Classic membership is $20. The Premier membership is $40 for an individual or $85 for a family. The Premier Plus membership is $75 for an individual or $160 for a family. The Elite membership is $50 for an individual or $100 for a family, and our Elite Plus is $90 for an individual or $190 for a family. The NEA Better Health membership also includes the following valuable benefits of MD Hotline: Protection Plus $1 million tax audit defense, tax filing service, ID Recovery Pros, mobile device protection, Good Path Direct, and Pet Assure. Over 70% of ER visits can be avoidable. With the unlimited MD Hotline benefit, treating members for common conditions and illnesses through virtual visits with live nurses and doctors, our members can have peace of mind from the comfort of their home or while at work, and there are no co-pays with the MD Hotline benefit. Also available to all member levels are Benefit Hub, Vivint Home Security, and AlloCare Health Medical Alert Systems discounts. Out-of-pocket medical expenses can break the bank. Emergency room bills can easily exceed $10,000 based on real-life experiences, placing a heavy burden on many individuals. Whether you have a marketplace or group medical plan, out-of-pocket expenses can be much higher than most U.S. adults can afford. But it's not just the obvious costs. There are many additional expenses that most people don't consider when dealing with a medical emergency or a chronic condition. These extra costs can be just as expensive, adding up quickly and creating significant financial strain. This is a claim example of an accident-related hospital confinement with a 2-night stay in Arizona. The scenario is a person is injured while hiking and sustains a fractured leg, requiring surgery and 2 nights in the hospital. The cost breakdown for the ambulance transport is $1,200. The ER visit and initial treatment is $2,000. The imaging X-ray or the CT is $1,500. Surgery is $12,000. Hospital room and board for 2 nights at $3,500 a night is $7,000. Medications, anesthesia labs are $3,000. Follow-up care and physician therapy is $3,000. The total estimated medical claim cost is $29,700. This claim example is for the Elite Plus and is an accident-related hospital confinement with a 2-night stay. The admission benefit is $10,000 and pays in addition to other coverage. The in-hospital indemnity benefit is $250, which pays in addition to other coverage and pays $500 for the 2 nights. Accident medical expense pays up to $10,000 after the $100 deductible. Accident emergency room of $100 pays in addition to other coverage. Accident emergency initial treatment is $100 that pays in addition to other coverage. Accident follow-up physician visits are $400 that pays in addition to other coverage. The total benefits paid in this example would be $21,100. And this is a claim example of somebody with cognitive health failure, exacerbation patient. A person at the age 58. History of hypertension and CHF. The symptoms are shortness of breath, fluid retention. The treatment would be intravenous diuretics. Telemetry monitoring, cardiac consult, and the length of stay would be 5 nights. Estimated cost for the ER evaluation, labs, and EKG is around $2,200. For the echocardiogram, around $1,800. For IV medication and cardiac monitoring, around $2,500. Room and board 5 nights is $20,000. And cardiology consults and follow-ups around $2,000. Total estimated cost around $28,500. This final example is for the Elite Plus. This example is for congestive heart failure with a hospital confinement and a 5-night stay. The Elite Plus pays admission benefit of $10,000, which pays in addition to other coverage. In-hospital indemnity benefit for 5 days, which totals up to $1,250. That also pays in addition to other coverage. So the total benefits paid in this example is $11,250. So, for the 2026 plan year, the in-network out-of-pocket limit for a marketplace plan can't be more than $10,600 for an individual and $21,200 for a family. The out-of-pocket limits do not include your health insurance premiums, any expenses and services your plan doesn't cover, out-of-network care, and services or costs above the allowed amount for a service that provider may charge. As you can see by these examples and the out-of-pocket limits for the marketplace plans, there are a lot of potential out-of-pocket expenses for a person or family to cover. Billing. We bank draft the member within about 3 business days. Credit card billing is available and has an additional $5 monthly charge and requires a brief GAC phone verification post-sale. It's very important to remind your client about it. We cannot approve the enrollment until verified. Effective date on the plan will always be the 1st of the month. Enrollment must be completed and submitted by the end of the month to be effective the 1st of the upcoming month. Recurring billing date is the 16th of each month. Shown to the right is a benefit summary, which is also found in the marketing brochure. The market is demanding affordable coverage options. Consumers and employers alike are struggling with rising healthcare costs and limited choices, creating a growing opportunity for flexible, cost-effective alternatives. What is our market? Consumers with the following types of plans. To start is the ACA Marketplace plans. In 2026, the out-of-pocket costs continue to climb as we have previously shown, with the individual out-of-pocket cost at $10,600 and family at $21,200. Next is short-term medical plans. Consumers are seeking relief from high costs of the ACA marketplace, and many short-term medical plans are carrying deductibles of $5,000 plus. Grandfathered major medical plans. Rising premiums on these plans have forced many to raise deductibles and reduce benefits to stay covered. More and more, you are seeing high-deductible group plans. Employers continue shifting costs to employees and raising deductibles, driving demand for affordable alternatives. All these examples can be a great fit to package with a better health option. If you have any questions or need assistance, please don't hesitate to reach out to your manager or our office. Thank you for your time today. We look forward to working with you.